So my name is Larissa Trega. I am a licensed clinical social worker. I'm also a master addiction counselor with a co-occurring disorder specialization. I'm also a certified MINT trainer. MINT is an international organization for motivational interviewing trainers. And I'm very excited to be part of this amazing organization that is doing everything it can to spread motivational interviewing throughout the world. As you probably already know, I'm an approved consultant with EMDRIA, and I am an EMDR consulting trainer. So what I'm going to do is go ahead and share my screen and working with complex presentations, behavior change, and ambivalence. So I hope you enjoy this presentation. So our workshop objectives for this workshop is to, by the end of it, for you to be able to identify specific strategies and tools for using EMDR with ambivalence, behavior change, and complex presentations. So we're going to look at the 8 phases and how we can work through these different things within those 8 phases. We're also going to learn a new preparation resource skill called SHIELD to support complex presentations. And we're going to also help you differentiate between a top-down and a bottom-up approach to addressing complex presentations. So by the end of this workshop, you should be more familiar with these different objectives and what we mean by them. So I want to start out with this quote that I find really powerful, that by Judith Herman, who said that no intervention that takes power away from the survivor can possibly foster her recovery, no matter how much it appears to be in her immediate best interest. So let's just pause here for a second and just ponder, what does this really mean? So if we are helping or trying to support someone in their healing process, if it in any way undermines their power or takes power away from them, then it cannot be in their best interest. And I would say that that is kind of the premise of motivational interviewing and in the way in which I practice EMDR. So let's start with just a quick overview of the 8 phases of EMDR, which you all know and use probably on a daily basis, multiple times a day. So phase 1 being history taking, phase 2 preparation, teaching skills, right? Phase 3 doing an assessment and beginning to get into processing. 4 desensitization, 5 installation, 6 body scan. If you're doing unrestricted processing, which is probably what most of you are trained in, and then phase 7 being closure, and then the follow-up session being phase 8, reevaluation. So that's just a quick review of what you already know. So now what I'd like to do is transition over to motivational interviewing. And some of you may have been exposed to motivational interviewing, maybe even practice some of the tools and techniques that you've learned about motivational interviewing. And for others of you, it may be brand new and you may have never heard about motivational interviewing, or MI, we call it. So to begin with, just a quick introduction or definition of it. So Bill Miller and Stephen Rolnick, who are founders of motivational interviewing, indicate that it is a collaborative conversation style for strengthening a person's own motivation and commitment to change. So notice, and maybe as you're looking at this, notice kind of what stands out for you about this definition. And then another piece of this is that it is a directive and client-centered approach for resolving ambivalence and eliciting behavior change across a broad range of behaviors. MI has been shown to be really effective in helping individuals with moving from stage to stage. If you're familiar with Prochaska's and De Clementi's stages of change, and also supporting clients in any type of behavior change that they want to be able to make. So you might be wondering, who can learn MI? And the good news is that anyone who has the desire to learn it and has the underlying belief that the other person, so the client in front of you, the patient that you're working with, has the answers within and the capacity to act on their own behalf. So this is where it's more that we are guides and we support our clients, and they have everything they need in order to be successful. Another point about MI that's really important to point out is that acquiring the skills is not related to years of experience or education or even a profession. And therefore, as Bill Miller says, even those with a PhD can learn MI. I hope you're smiling or chuckling right now. And that for many people, it's actually the unlearning of old habits that is as important as actually learning the new skills. So, interesting, right? That it's not so much learning MI, it's more about unlearning some of the habits that we form over time in our practice. So, what about MI with different cultures? It's a very interesting topic right now, as we know, with so much turmoil and so much going on in our nation and the world, that any approach that we use is culturally sensitive and multicultural. NMI happens to be very multicultural. It has been normed with different cultures, different populations, and has actually been shown to work especially well with the African American and the Latino population. So I would just encourage you, as you're kind of going through this presentation, think about what is it in particularly about MI that makes it so effective in working with the minority and the underserved population. It's also important, right, that we understand the client's cultural strengths, their risk factors, and understand their identity and how their identity can help enhance their engagement. So what does this look like? So we've got what we call the 4 processes of motivational interviewing. Really, everything we do through the lens of motivational interviewing is through one of these processes. So for instance, the first one, the foundational process, being engaging, right? So for us in EMDR, that's phase 1, right? It's phase 1 is about engaging the client, learning about them, understanding their landscape, connecting with them, creating safety. So this is engaging is the process in motivational interviewing, where we are just trying to get an understanding of their perspective, their concerns, and the like. Then once we've engaged them, we can move on to the next process, which is called focusing. And focusing is really kind of dialing in and looking at, all right, so you've got these different concerns. Where do we want to start, right? What direction are we going to take this in? And we'll talk more about these processes as they kind of mesh with EMDR as we go through. For now, let's just kind of take in just the MI piece, and then we'll get into the integration. With evoking, which is once we kind of have found direction, once we know where we're going, then we can get into the process of evoke. And the evoking process is all about understanding where is this person in their process of change. So this is where the stages of change kind of come in, even though they're not part of the motivational interviewing approach, but they go hand in hand, if you will. And then what's the fuel for the journey of the individual? So what is it that drives? How can we strengthen their commitment, their activation towards taking? And then finally, once we have solidified the process of evoking, where the client is clear on why they want to make the change, why they're doing what they're doing, and what's their fuel for their journey, we can move into the last process, which is called planning. So planning is they're ready to move forward, right? Then now it's okay, so what is that going to look like? And it's different depending on what you're doing, whether it's MI or just EMDR, but there's ways that you can integrate those. And so we will look at that today as well. So 4 processes, try to keep them in mind as we go through, and I will be referring to them, but definitely This is kind of everything we do through the lens of MI falls within one of these. So as I said, right, engaging is the foundational piece, or the primary kind of basic block that we need to spend some time in, is the strategies of motivational interviewing. So there are 5 strategies, and we call it ORS plus I, and they stand for: O stands for open-ended questions, A for affirmations, R for reflective listening, summarizing, and then information offering. A lot of us may be really good at offering information, but what you will learn here is how to do it in an MI adherent way, so that the client actually receives the information and is more likely to maybe do something with. So here, what I've done is just given you a little visual of the 8 phases of EMDR. And as you can see, got the 8 phases of EMDR in kind of what we're doing. So with phase 1, history taking and target planning, motivational interviewing is going to be primary. And in terms of phases or processes, what you're doing here is working on engaging and the focusing process. Phase 2, preparation, right? If there is any ambivalence about doing EMDR, this is where you can use motivational interviewing to help resolve the ambivalence. So we use the EPE method, elicit, provide, elicit, and then evoking, right? So strengthening their motivation for focusing, right? We're narrowing it down to one thing that we're going to work on today. And then there's evoking, because we're trying to evoke some sort of an emotional charge so that we can get into desensitization. And during desensitization, phase 4, really what we're doing is we're continuing to focus on the target and the evoking process of getting the client through the processing. Phase 5, installation, minimal MI really here, but if you do anything, it's going to be more planning, right? Planning for the future. Body scan is more around evoking, so just kind of seeing what's still left there and clearing that out. And then phase 7, closure, is where you get to do some MI, but not too much, because you're just kind of wrapping things up. You might do a resource here. So there may be some evoking around shifts that they've experienced, insights they might have for in between the session. And then finally, phase 8, when they come back with reevaluation, MI here is going to be really critical when with you trying to reevaluate the target, but then also have that integration with the 3 prongs. So depending on what the client comes in with, picking up kind of where they left off. So in phase 8, I would say you're using all 4 processes of MI. So you're doing engaging again. Every session we do engaging, right? Focusing, and then evoking and planning, depending on where the session goes. So with phase 1, engaging complex presentation, with EMDR, our goal is to build rapport, right? And we do that by creating a sense of safety. We begin our kind of biopsychosocial inquiring about the presenting complaint. When we're starting to do the target sequence planning, we might use or before we even do any target sequence planning, we might use the flash technique, those of us that are trained in that, to kind of help stabilize or ground the individual, maybe do some resourcing, or those of us that are trained in some sort of a crisis intervention technique, using something like that. So I am trained in CID, critical incident desensitization, and ATIP, and I might use that to help reduce the SUD if a client is in a crisis when they're coming in. From the MI lens, what we're doing here is we're using the spirit of motivational interviewing, right? The pace, we're using the ORS plus I, and the processes of engaging and focusing. Really, that's what we're doing, right? So we're evoking the person's areas of strengths, their resources and skills during the assessment process. We're also looking at their areas of need, right? So what are they struggling with? What's causing them stress or distress? And at that point, we're also listening for change talk or sustained talk. We're listening, how motivated are they? Are they ambivalent at all? What's happening with that, right? So once we get to the second part of phase one, where we're doing a target plan, right? What we're doing here through the lens of MI is really, again, focusing and evoking now, right? And so the target sequence plan that you will see me work on is called belief focus. So you will see that the way that I organize the material is surrounding the belief the person has about themselves, so the schema. And so during this target sequence plan process, we might again be eliciting and evoking the client's areas of strength when we're doing the adaptive belief, their attributes and skills and accomplishments. This is where we also get to use the float back technique to try and identify the touchstone experience. I refer to it as a bridge back, but either one is fine. And question might be, what might be a potential future situation that would trigger a similar reaction? Okay, so where you might feel responsible for everything and everything. And then this is an optional, because if the client is not ready to go back there, then you may not go there to do the float back and try to help them identify the earliest memory when they felt this way and see where they might land. So 8, so reevaluation. We know that a lot of times with EMDR, we may do the work, right? And then they come back and they're having a hard time kind of with integrating the shifts that they've experienced into their life. So this is where MI is going to be critical, right? And so through the lens of EMDR, we first start with just doing a global check-in, right? And we're going to use the process of engaging through MI. We're going to inquire about insights, shifts that they might experience. Then we're going to look at the presenting complaint, okay, and the symptom, as well as target specific check-in. So if the symptom was, let's say, you'll see a video of a reevaluation. If the symptom is, let's say, an olfactory, smell is a trigger, then you're going to check in with that. How are you doing with that, right? So we worked on this last time. Where are you at now? We're going to inquire about any insight shifts, dreams, and then we want to try to elicit disturbance, right? So we're checking in with the presenting complaint, and then we want to get into processing if it's indicated. So that's what I'm going to do with the client. This is where you can use motivational interviewing to help support them, again, through any ambivalence they might be having, helping them with the ruler questions to increase their level of commitment, their motivation, if they're regressing, right? And then focusing would be you going back to the agenda map that you might have developed. And if you haven't, then maybe this is where you would do it. And this is really if you cannot do EMDR, right? Because if you can do EMDR, you're just going to go straight back into reprocessing. And then once you finish that, then you're going to pick the next target in the 3 prongs. And then, of course, anything else, right? So if there's any need for more resourcing, teaching new skills, this is where you're going to do it. And if you are going to do number 5, then you want to use the EPE method, the elicit, provide, elicit, and the ORS plus I. Okay, so just a quick, again, looking at the 4 processes, engaging, focusing, evoking, and planning, and being able to, as I mentioned, right, that when we, with EMDR, we're able to clear out channels of association. And that doesn't necessarily mean that the client is now prepared to make the behavior changes that are necessary in order to maximize on whatever the benefits might have been. So for instance, the client maybe has stopped drinking through a combination of MI and EMDR. However, maybe they're still not going to a meeting because they have a fear of being judged by others, right? So this is where you have an option with MI to try to explore that further, elicit their importance and confidence around being able to be seen in public. Or you can identify the irrational belief of there's something wrong with me, I'm a failure, or I'm defective, and then from there develop a target plan around that belief. and do more EMDR. The spirit is the foundation. This is the basis of engaging our clients, and something that we use throughout the different processes. The micro skills of the ORS plus I are really critical in helping us with the direction of where are we going, what's our destination, and then the change talk of being able to listen for and help elicit from your clients, why would they want to make a change now? How would they like for things to change? Past experiences of successes they've had, right? Reasons for making a change, what's at stake if nothing changes. And then once we build up that change talk, then we're able to elicit from them the act of activation, commitment, and then taking steps. So I hope you enjoyed this presentation. Just want to say that I could go on for hours and hours about this, as I feel very passionate about this topic. Some resources you might explore are, depending on what your setting is and where you're doing your EMDR, I would really encourage the Motivational Interviewing Skills with David Rosengren is another great book if you want to really hone in and learn more about motivational interviewing and different techniques. And then if you work in schools, there's a couple of resources there as well. Number of other resources that I'll be sharing with you. So thank you again. It's been a pleasure. I hope that this was beneficial for you and that you are able to take away at least one nugget that you might incorporate into your practice on Monday when you are back to work. Thank you very much.